Hello everyone, welcome to Functional Nurse Academy Graduate Spotlight. For more information, be sure to visit functionalnurseacademy.com. And here's your host, Nurse Melissa.
Hello and welcome to Nurses Out Loud on America Out Loud Talk Radio. This is your host, Melissa Schreibfetter, founder of the Functional Nurse Academy and the Christian Functional Medicine Academy. Welcome, everyone. I have decided with the Functional Nurse Academy, I'm going to be doing a new thing where each month I feature one of my wonderful graduates because they're all doing such great work. And I'm so excited about the different specialties the nurses that I'm training are coming up with and how they're just serving so many people. So today my guest for today is going to be Bonnie Ridge, who has graduated from the Functional Nurse Academy. She is a nurse practitioner with multiple board certifications, and she is just deeply passionate about educating individuals on how they can take control of their own healing. And she is a fourth-generation medical professional and is committed to nurturing the health and well-being of her clients through holistic approaches. Her focus goes beyond just treating symptoms. She's dedicated to understanding the real root causes of health concerns. And she combines the best of conventional medicine with evidence-based complementary therapies such as nutrition, lifestyle changes, and stress management. And she has two businesses. She has Renew Integrative Wellness and Integrative and Functional Health. And one of her niches, which I think is so important to talk about, is food allergies and food sensitivities. Welcome, Bonnie. All right. Well, just a minute. We're having a little audio issue. And again, not a day goes by where I don't have some type of problem with tech issues. But anyway, before Bonnie and I went live, we were talking about I can hear audio. Okay, Bonnie, do you want to try to talk and I can see if it's picking it up? Oh, I still cannot hear you. I'm sorry. Well, anyway, before we started the show, we were talking about, I remember I was born in the 80s and I did not know, I think I knew one kid with allergies, but I had never heard of peanut allergies or anything like that. And now it is so incredibly common, and it is something else that is just becoming normalized. But we know with allergies and food sensitivities, many of the times these things are rooted in immune dysfunction and also gut issues. When you are having severe gut imbalances, when you have overgrowths of opportunistic bacteria and all of these different things, what happens is we can get what is called intestinal pregnancy brain, intestinal permeability, which is also called leaky gut. It is something that is absolutely overlooked in the medical system.
Plug to my mic.
I can hear you now, Bonnie. Welcome.
Let me unplug my mic. I'm sorry.
You're okay.
Oh, there we go. I can hear her. Can you hear me?
Oh, yes, I can. Okay. Yeah, well, sorry about that hiccup, everyone. Well, I have Bonnie on the line now. So glad that we were able to do this. And whenever I have one of my graduates on, I always like to have them pick a functional medicine topic, and then talk about how they are helping clients heal in their practice. And I would love to hear from you, Bonnie. Could you tell me just about your background from, being a conventionally trained nurse to moving into the holistic side of nursing?
Okay, wait, can you hear me here?
Yes, I can.
Oh, okay. Okay, great. Sorry. Okay, yeah, I got into nursing because of my parents, my dad being oh, shoot. Oh, yeah, I'm not sure which. Okay. Um, being a physician, he practiced for 57 years, and then my mom was a midwife and surgical nurse, and so I got into nursing because of that, and it just goes back to generations, great grandfather practicing out of their home, and they actually had a home clinic that they would see patients and they would just come, to their home. And there was like no insurance, that kind of thing. It was like a bartering system. And so it goes way back to that, and my grandmother also would use like a pestle and mortar type of thing to grind medications and just put things together and educate, the patients. And so I really like that, about nursing, educating and helping our patients be more proactive, in their health, and to support them and guide them. And so I really like the whole nutrition and lifestyle type of aspect about nursing and helping people, to help themselves, So, yeah. And then,
Oh, I was just going to say, well, obviously, as an educator, that is like my favorite part of nursing is the education piece, because there's so much we can do to help people to heal from the inside out.
yeah, yeah. And, yeah. And then, I went to Loma Linda, for undergrad, and I just love that Christian, environment, right? And to make man whole, right? And so I really, really like that kind of community and that mission that they had and still have, And so I just, I just really like that that whole idea.
Mhm. Yes, yes. I remember when I went into nursing because, and this is not sarcasm, people, like I actually really do love people, and I wanted to help people, but then I got out into the field and I just felt like I was like a Pez dispenser for medications. And then these poor patients just go through the system. We know we have a problem with informed consent and the education is lacking. And when you're working in that system, I mean, you have God knows how many patients and you have all of this charting and then the care, just these people just get underserved. So I know that you mentioned, and again, I think that so many of us find our niches from, personal experiences. And I know that you mentioned that one of your specialties is food allergies and food sensitivities, which is amazing. And I remember you saying that you got into this because of, an experience with your children. Can you tell me
Yeah.
about that?
Oh yeah. It started when I had my boys. They're 11 months apart, so they're very close in age, and I had no idea, about food allergies. And so my older one, I guess he had some issues, but it wasn't very apparent because with food allergies, sometimes you see, a lot of um, skin rash or eczema and then vomiting and things like that. And he didn't really have any of that, So I didn't notice that until I had my son, my second one. And that's, when I really noticed it, because he was very lethargic after nursing him, like it was after birth. And so and then he developed eczema, and so he just had a lot of and respiratory issues, coughing, runny nose. And so then that's when I realized that, oh, something's going on with him, because we ended up having to do antibiotics, oral antibiotics, topical, and then steroids, right, on the skin. And then we realized that it was food, that he was actually allergic to a lot of the ingredients in the formula that I ended up having to give him. And I felt really guilty about that too. But they started him on that right away, like when at the hospital. And so it was right after birth that I noticed that something was not right, and but I didn't realize it had to do with food allergies and sensitivities until he was like 9.5 months. And I talked to the pediatrician, and at first he was just saying that eczema is really difficult to treat. And but it wasn't until his assistant, his nursing assistant, she pulled me aside and she told me that, I think he's got food allergies. You should ask him, for a blood test. And I had no idea, and now when I look back, I realize I think it started after his vaccination, at the hospital. And then his 2 months, that's when it was really bad with his eczema. And then it turned out to be food allergies. Yeah, a lot of food allergies and sensitivities. Yeah.
And I'm so glad that you are being transparent about, your experience, because I feel like after the COVID vaccine, the landscape on talking vaccines has changed to where it's just something that people talk about now. But this is another thing where parents are just not getting informed consent. We know that the vaccines that we give to very young children, and guys, for our listeners, if you compare the United States childhood vaccine schedule to the vaccine schedule of countries that have much healthier children, such as Sweden, Norway, Japan, you will see that they are giving like about a third of the vaccine doses, and they're starting much later. But there is that component where, if you look at a vaccine insert, it clearly says that immune disorders are a known adverse reaction. But do the mothers know this? I know I didn't with my first one. And I've talked I feel like it's like I came out of the closet one day as a holistic nurse. And as soon as I was like, oh, that's when all these people started telling me about their vaccine injuries and their children's vaccine injuries. But when I was a conventionally trained, ignorant nurse, I never even heard any of this. And now kind of figured out what was going on. How did you help to support his body? And by the way, yes, God bless you for having two babies 11 months apart. So yeah, I'm about to have two that'll be 22 months apart. And I'm just like, oh, I'm not going to leave the house for like 3 years. So how did you work to support his health? Because I know with conventional medicine, they usually will go to like steroid creams and things like that. Yeah. They're just not focused on like what's causing it.
Right. And then you know how the steroid suppresses our immune system too on top of it, right? And then I was so unaware. I'll be very honest, I was so unaware of like food, like the GMOs, things like that. I was eating all kinds of stuff and not even realizing it, just like the vaccines, not realizing that it would have an effect, a negative effect on them, so they were getting their vaccine scheduled, routinely, just didn't even think about it, didn't think twice or question it. And we went through that for a period of time, and but he was very reactive, and it was really bad. But I had no idea. It got down to the point of eliminating all these foods, right? And so he didn't have a lot of safe foods to eat. And I thought, wow, something's not right with this, this whole paradigm of how we're supposed to, treat, people with food allergies and sensitivities, and I thought there's something else going on, So there are a lot of toxic things that I ended up not realizing that we were exposed to, like the creams, right? That I had him use. We were using Eucerin for years, on top of the steroids, and then we ended up using oral antibiotics, topical antibiotics, and bleach baths. We ended up with bleach baths too, from the dermatologist, and even stronger steroids, right? And then he was getting vaccinated. I mean, it was just all this, and I actually didn't even realize until like 10 years ago that there's this whole other side, of treating, chronic conditions and health and wellness, right? I had no idea until I actually stumbled across this guy who talked about healing his cancer, okay, actually from holistically, from nutrition and diet and lifestyle changes. He opted out of chemo, and that actually opened my eyes because I worked in oncology also, and so I thought, oh wow, there's another way, so it was eye-opening for me. And then that's when I kind of went down the rabbit hole of looking at the other side about things. And even people in the food allergy community that I connected with about 14 years ago on social media, I heard some of them talking about how their children ate, peanuts just fine. And then somehow, something happened and they started reacting, and they were talking about vaccination. And I thought, really, but it still didn't really sink in, because you kind of have to unlearn a lot of what we've learned in conventional medicine, right? In order to learn all this new alternative holistic way of thinking, mindset. And so it opened up my eyes. I started looking at what could be causing, instead of all this research and money that are being put into treatment. I really wanted to know what is causing all of this. Like, why are we conditioned to think that children just get sick all the time? Really? There must be something to that, right? So
I saw this really funny meme, and it's so true, but it was of a woman taking her dog in to see the vet, and the woman was like, the dog is having these stomach issues and this issue, and the vet was like, well, what is the dog eating? Is the dog sleeping? Da, da, da. And then there was a picture of a patient seeing a regular physician, and the physician was like, okay, for stomach pain you can have this drug. For this, you can have this drug.
Right.
And again, there's so much indoctrination and
Yes.
the system. And one of the things doing functional medicine,
Mhm.
there are going to be people that are going to accuse you of being a quack, because Wikipedia says
Mhm.
that functional
Yes.
medicine is quackery somehow, in some just weird world that people live in, that giving a drug that suppresses symptoms and doesn't fix
Mhm.
what is causing the dysfunction is
Mhm.
totally fine, and that is good medicine, and that's the science. But
Yeah.
actually trying to figure out what is causing the dysfunction in the body,
Yes.
that's quackery, guys. Don't do it. Like, it just
Yeah.
doesn't. It's so backwards, and it doesn't make any sense.
Mhm.
And
Mhm.
also, there are and I also went through this when I had my son, again, with pregnancy. That is a
Mhm.
major hormonal immune
Mhm.
shift.
Mhm.
Also, I
Mhm.
had a ton of vaccines, which I absolutely think was, part of the situation. But
Mhm.
I experienced severe immune system dysfunction, reactivation of Lyme disease, and
Mhm.
autoimmune flares, and then hypersensitivity reactions to all
Mhm.
kinds of foods. And
Oh, wow.
I'm so much better now after having
Mhm.
the Lyme treated. But there are even, just functional providers that still don't get it and will
Mhm.
still just recommend highly restrictive diets. And it's kind of like,
Yes.
hey, it's
Mhm,
true. This food may be causing an immune reaction, but we should
mhm,
be fixing why
mhm.
you're reacting to all of those foods. So,
Right.
can you tell me, when you are working, with a client who is dealing with these types of hypersensitivities,
Mhm.
what are some, holistic modalities that you find are really helpful?
Well, it's a lot of, going over what they're eating, right? Of course. And then their stress level, because, everything's all connected, interconnected, right? Like our nervous system is connected to our immune system. And so we have to look at all of that, and sleep, oh man, sleep is like a big thing, And I didn't think about that either, thinking, it's fine to just keep going, right? We're just taught to just keep going. But yeah, sleep is a big factor. And then diet, lifestyle, your relationships, even, with who you are interacting with on a daily basis really matters. And so we don't talk about that sometimes, and then supplements, I do think we need it sometimes to get things rolling, right? We want to heal the inflammation that might be overwhelming our system. So we want to always do that first before we, look at what else is, triggering, like inflammatory foods that they're eating. And so we want to kind of eliminate that for a little bit, to kind of calm the body and immune system down before we, go after pathogens if there are pathogens that need to be eradicated. And but work on all these other things too, like nutrition and lifestyle that we can, incorporate into our lives, So
Yes. And I love that you are mentioning the foundations because, again, and with supplements, like,
mhm.
oh, I have like a love-hate relationship with them because I so had practitioners that they just wanted to sell stuff and they didn't even
Yeah,
care. But,
yeah.
there are tools, there are herbs, minerals, antioxidants that
Mhm,
we can use to really facilitate the body's really unique and magnificent healing process. So there are absolutely appropriate uses of them. But
mhm,
again, I mean, I think that this is another functional medicine fail when practitioners are like, okay, take these things.
mhm.
But then that person is stressed and they're like not
Mhm.
sleeping. And again, you cannot out supplement a poor diet. You've got to get back
Right.
to eating the foods that we're designed to eat. I mean, I cannot tell you how many Pop Tarts and Cheetos and Doritos and, probably drinking 2 liters of Coke a day back in the 90s. I'm like, I didn't know how bad that stuff was for me. I mean, I'm like, it's shocking I don't have diabetes. Um, but anyway, there's so much really. And again, I also look at it like we don't want people to be scared to death of things, but we really need to educate them. If you're
Mhm,
on your screens late at night, that is
mhm,
going to impair your body's signaling to produce melatonin, which is also a potent
mhm,
antioxidant. And that is
mhm.
like your bedtime sleepy hormone. If you're
Yeah.
not getting enough sleep, when we sleep, that's when the body is ramping up the detoxification processes and
Mhm,
working on the self healing and all these things.
mhm.
Well, we are about at the time to cut for a break. Your side of the break. If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreibfetter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our functional nurse toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com. Welcome back, everyone. This is your show host, Nurse Melissa Schreibfetter, and you are listening to Nurses Out Loud on America Out Loud Talk Radio. At Nurses Out Loud, we are here 5 days per week, and we play on iHeartRadio at 10 a.m. Eastern Standard Time. So make sure that you tune in each day. Every day we have on a different nurse show host, and on Fridays we gather together for a Q&A with the nurses. So you can absolutely reach out to us. You can email us, submit your comments and your questions to nursesoutloud.com. Welcome back, everyone. Today I have for my guest, I have one of my graduates from the Functional Nurse Academy, who is the Functional Nurse Graduate feature for the month. I have Bonnie Ridge, who is a nurse practitioner and has multiple other board certifications in functional medicine and holistic medicine. And we are discussing food allergies and sensitivities. Welcome back, Bonnie.
Thank you.
So I know before we cut to break, we were talking about how, yes, supplements can be used appropriately, but we also need to make sure that we cover those foundations of wellness first. And I also really liked how you mentioned that you like to make sure you're removing triggers, supporting the body before you're giving all of these kill agents. Because a lot of times when people have gut dysbiosis, which is when they have too much bad bacteria, not enough good bacteria. A lot of times, if this person is super inflamed, super triggered, and then we're like, here's all these herbal antimicrobials, we can make them worse. So I love that you are paying attention to that. And I wanted to ask you specifically, are there certain, herbs or other nutraceuticals that you have found helpful in the cases when people are suffering with food allergies and sensitivities?
Oh, not specifically. I mean, everybody's different, and I'm still working on that, to maybe narrow it down to only specific ones, but yeah. So
yeah, and again, and this is another reason, and a lot of times I have nurses that go through my program and they're like, okay, what protocol should I use for this? And I'm like, oh no, it's personalized wellness plans. Because again, one thing that works for someone may not work for the next person. But there are some things I have found to be really, really beneficial, which again, these are things you can take in supplement form. You can also get them through food. And those are things like L-glutamine, which bone broth is really rich in that. Zinc. Zinc is a big deal. Your gut needs zinc to heal. And a specific form of zinc that's especially helpful for the gut is zinc carnosine. And then also immunoglobulin powders are also really important for, supporting the immune system, rebuilding that gut barrier. There are a lot of really great tools that can be used. But again, it's important to assess, okay, what is the toxic burden? Because again, I know that you mentioned earlier that like when your son was dealing with all of these things, like as, a mom with babies so close in age, and I'm sure that, doctors are just fine with recommending these, skin ointments and creams that have
Mhm.
who knows what in them.
Mhm, mhm,
So have you found for someone who's really suffering, and again, I know there's a time and place for, medication, because sometimes
mhm,
you need to triage, especially if that person is suffering and not sleeping. But
mhm,
um, so we know that steroid creams are usually prescribed, but
mhm.
what are do you have recommendations of more like holistic, cleaner versions that like topical solutions that can help with eczema?
I have I like this one brand. It's called CLN, to clean your body, your skin. So we use that, and I like Happy Cappy. I usually recommend that for your scalp, and you can use it on your face too. And so that I've gotten a lot of good feedback about that. And then there's this spray that kills the bacteria on the skin as well. Yeah. I can't, I'm sorry. I am blanking out now right now. So,
It's okay. My pregnancy brain is contagious. So no, I'll just be talking, and then I swear the wrong words come out, and it's not as embarrassing now since I'm like telling everyone I'm pregnant, but anyway, there absolutely are like cleaner versions of lotions. And when I look back, and I just, and thank God, once you know, you do better. But I remember when I was pregnant with my first kid, I mean, I was eating the food at the hospital cafeteria. That's like, I mean, that's probably like equivalent to, jail food. And then I was I was sending my husband out to go get like Sonic Oreo Blast, and I was putting, lotions, like rubbing lotions onto my body that like had all kinds of chemicals in them, and I just didn't know. And
yeah.
I will say, like, it is so, it really is magnificent. There's certain population of people,
Mhm.
they will get well by just getting the chemicals out of their food and their products and repleting nutrients in the body
Mhm.
bounce back. And there's
Mhm.
other people that may have more complex issues going on where their bodies need a little bit more work and they need more targeted plans.
Mhm.
But it is really amazing when you go from conventional nursing where you're told that like, oh, all these diseases, yeah, can't heal. We can't heal diseases, guys. We
Yeah.
just medications for them and manage the symptoms. Once you
Mhm.
go from like practicing that way and believing that, and then you actually see people heal, it is just, I mean, you can't unsee
Amazing.
it and you can't shut up about it. I talk to people
Yeah.
about this all the time, but I
Yeah.
also to ask you, so what is your opinion on things like food sensitivity testing? Is that something that you have found helpful?
I think it's helpful, to somewhat narrow it down to what foods are triggering you, so that you can avoid those. But it's so hard because I've tried different ones, and I just don't know which ones are, which one is the best, because there's always, positive, um, um, sorry, false negatives
False
and false
positives
positives.
and
Yeah,
negatives.
yeah.
Mhm.
And so,
And
yeah, and it's always, the reaction, right? That is the true, way to figure out, is trying it and having a reaction, but you don't want to do that either. So, yeah, I've tried different ones and I'm not really sure, but I'm looking actually at the MRT now, blood test. Yeah. So, okay.
and with food allergy, well, food sensitivity testing,
Hmm.
and the way that I look at it, I don't want to just be poo-pooing everything because then I'm
Hmm.
the same thing that conventional docs do when they say that everything we're doing is quackery. So I want to be
Yeah. Yeah.
open-minded. But I do think it's absolutely a tool, especially when
Hmm.
someone
Hmm.
really is suffering with all of these
Hmm.
sensitivities. And you do need to
Right.
do that research to narrow it down. But one of the downsides is, when people are having like food allergies and sensitivities,
Mhm.
they're also going to have some significant leaky gut. So you're
Mhm.
going to have this happen to where they're eating these foods. They may be eating their favorite foods that may happen to be
Yeah.
really healthy, like
Mhm.
blueberries. And
Mhm.
you may get a false positive, not because
Mhm.
they're sensitive to it, but
Mhm.
because they have intestinal permeability. And again, if somebody has really bad leaky gut,
Mhm.
like I did when I had Lyme, their
Mhm.
food sensitivity test is going to light up like a Christmas tree, you
Right,
know? So,
right.
so again, you just have to really use that clinical judgment. And
Mhm.
the tests are all different, you know?
Yeah.
So
Mhm.
I know I had worked with practitioners before that would use Dunwoody Labs.
Yeah. Mhm.
There are one thing I am kind of skeptical of. There's
Mhm.
a lot of functional medicine tests that are like super low cost. Well, not super low cost, but they're affordable and they're
Mhm.
marketed directly to consumers.
Mhm.
Some of those make me
Yeah.
nervous because sometimes I see clients coming in with the tests they ordered online and I
Mhm.
can't find any clinical validation studies for. So I do think if you're going to go and consider food sensitivity testing, going through a practitioner is the best route.
Okay.
And I also wanted to ask you
Mhm.
about your experience with Functional Nurse Academy and how this,
Yeah.
impacted your professional growth because I saw so Bonnie is in my Facebook group, which is Functional Medicine for Nurses. I had no idea that you had gone to like you had so
Mhm.
much training and holistic and functional medicine education. And it was so flattering that you had such nice things to say about Functional Nurse Academy. So what was that experience like for you?
Oh, yeah. I just love how you go over the functional labs, and also the business aspect, because I ended up taking a lot of business courses, separate from clinical, functional medicine programs. And so it was, and then some of them just didn't cover, one or the other. And then some, it was really difficult to figure out how to apply it, right? It was a lot of research, and then you can't even figure out how to apply that, into practice. And so I just love Functional Nurse Academy because you had it all there, and it's just great to go through it. It flows and everything, and you cover everything that um, we need, to start out. And I wish I would have seen that had, but I went through all these other programs first. So, and it's affordable too, and I love the practitioner toolkit that you have. Yeah, everything's there. Hmm.
Well, I'm so glad that you enjoyed it. And I will say, I feel like, I do hear from nurses frequently,
Hmm.
feel like they got scammed. And again, I'm not talking badly about like,
Hmm.
certain, specific programs. I'm not going to name
Hmm.
any
Right.
programs or anything like that. But
Yeah.
just in general, I'm seeing an increase of like, just different programs for like that are marketed towards
Hmm.
nurses. Like,
Hmm.
and, like it could be an MLM or it could be some
Hmm.
kind of training program or
Hmm.
whatever. But
Yeah.
it is well known in the
Mhm.
world that nurses are unhappy. And I think that
Yeah.
nurses are getting preyed on, and,
Mhm.
and
Mhm.
it's really like it's hard to watch because we've already been mistreated in the system for so long. So
Mhm. Mhm.
sometimes we're just desperate to get out of that system. And then
Mhm.
someone's telling us that, like, oh, you know, I've got this really good plan for you. This is going to
Yeah.
help you do this, this, this. And then they
Mhm.
finish whatever the program
Mhm.
is. And then they're
Mhm.
still working in the hospital, and I so
Mhm.
badly wanted to help
Mhm.
nurses to get out of the hospital and then have them in independent practices. That way we
Mhm.
can actually work on getting people healthy enough and
Mhm.
getting to the root causes of disease to where people
Mhm.
don't need to utilize the hospital system as
Mhm.
much.
Mhm.
So,
Yes.
but really
Mhm.
there's so much nurses can do. And I mean,
Mhm.
honestly, patients are kind of more comfortable with nurses sometimes
Mhm. Mhm.
than they are
Yes,
with
they
the
are.
physicians. So
Yes.
now, I did look at both of so you have two practices, right? And
Mhm.
your
Mhm.
websites look lovely. Like they're very pretty, it's really organized. So can you tell me about your practices?
Okay, with the Renew Integrative Wellness, I actually just started that last year. I'm a co-founder with my physician, and I'm only practicing with patients in California with that one. Using functional medicine, integrative. And the other one is the integrative and functional health, which is more of a coaching type of educational, to guide people and support people through going holistically, and more functional. Yeah. So, and I started that one actually a few years ago. Yeah.
Okay. Okay, great. So now, okay, so you have one, because I know you're in California. So you have
Mhm.
one practice where you work with the physician, where you're doing more more medical, and then your
Yeah.
other practice is more like coaching and consulting. So
Mhm.
which I do love that, because
Mhm.
again, I mean, so much of what we do to heal people is through education. And the
Yeah.
nurses, you're naturally good coaches anyway. I mean, this is basically what we're doing, for our profession. So with
Right.
your coaching and consulting,
Mhm.
are you able to see clients virtually? How does that work?
Oh yes, actually both of them are virtually. Yeah. 100% virtually. Yeah. Mhm.
Okay, okay, great. And are you serving clients just in the state of California, or are you able to see them across state lines?
Across state lines, but I'm somewhat limited because I'm not going to be diagnosing or prescribing with that one. Yeah. So.
Okay. Okay,
Mhm.
good to know, because I just feel like, people just need more access to these types of services. And I think
Mhm.
it is
Mhm.
a wonderful thing, because again, another thing about COVID, like a silver lining of COVID,
Mhm.
is people are really enjoying the convenience of being able to
Mhm.
meet with their practitioner
Mhm.
in the comfort of their own home. Because again, when you're doing coaching and consulting and things like that, like you don't really need to have a physical office and like an exam table and all of
Mhm.
those things.
Mhm.
So, are you currently accepting new clients?
Yes, I am.
Okay, awesome. Awesome. So,
Mhm.
I'm at your website now, and
Okay.
I see a button for free consult. So if one of our listeners is interested in working with you, they could just click on that free consult button and then
Oh,
book a
yes.
call with you.
Mhm. Mhm.
Okay. I also really, really love that, because again, I feel like if you're trying to work with a healthcare professional,
Mhm.
I do think it's important that like we're able to just get on the phone with them for free. And that way they
Mhm.
can talk to us and they can get to
Mhm.
know us. And,
Mhm.
I feel like when you're looking to work with a practitioner, you get that feeling about someone if you jive well with them, and then
Mhm.
you can also kind of like pick up on, like the that person's energy.
Yeah.
And after having a conversation with someone,
Mhm.
you can tell, I think that you can tell if they're genuine or not, and you get that
Right.
feeling like, okay, I think this person's going to help me.
Uh-huh.
And yeah, I feel like there's a lot of practices where, well, this is like with the big practices where you
Mhm.
want to work with someone,
Mhm.
and but you call and you get a salesperson, and then you
Yes.
don't actually meet with the
Mhm.
practitioner until
Mhm.
you've already paid.
Mhm. Mhm. Right.
So,
Right.
okay, great. And I know that so you're real savvy and like the allergies, food sensitivity. What other conditions do you work with?
I really try to focus on the gut, of course, because that's always the foundation of everything, but I was looking into hormones too, because, obviously our hormones, affect every aspect of our body system as well. So, yeah, so I was looking at that. And then recently I also looked at skin, I took a course with a naturopathic doctor to get into that, because a lot of the people with food allergies and sensitivities end up with skin issues, right? So I wanted to be able to hone in on that, and really help them overall.
Yeah, guys. And everything is so interconnected. And I just cannot think of, here I am getting sassy again. Okay. I was like, I've got to stop calling things stupid, but sometimes I just can't help myself. I mean, in the Bible, like Jesus would call people foolish if he needed to. But anyway, I can't think of anything more stupid than fragmenting care, where you have your primary care physician and you're like, oh, I've got migraines. And then they're like, okay, go see the neurologist. I've got
Right.
hormonal issues, go to the OB. And then no
Right.
one is communicating. And I
Right.
love that you mentioned hormones because, oh my goodness, like hormonal chaos for women and men,
Yes.
really, really for women. And then also, with the gut, so many of our hormones are
Mhm.
actually produced in the gut. So what do we think
Yes.
is happening when
Mhm.
our guts are a wreck? And also, I like that you are really honed in and you have so much education about the nutrition because, you know, if someone's diet sucks,
Yeah.
we get
Yeah.
people easy, and then we're
Mhm.
constantly being tempted with convenience foods. But if people
Mhm.
are like, you need to have mineral
Mhm.
nutrients and minerals and all of
Mhm.
these wonderful things we get from our foods for
Mhm.
precursors for things like your hormonal production. So,
Right. Right.
so
Yeah.
yeah, and I also wanted to ask you, so say that you're working with someone and, you start talking to them about nutrition and their
Mhm.
nutrition's like not looking too good, what are some things that you have found helpful, like kind of on the coaching side of it to help people to make those better dietary choices?
Well, I know that's always hard because, people really have a hard time giving up certain foods, right? I think we all are guilty of that, right? To some extent. And so like, I have to have my 1 cup of coffee a day, um, but I did give up, creamer. So now it's just black coffee, but yeah, it's really hard when you're talking about, dietary changes, right? And so, I just try to get them to eat more veggies and fruit, just to add maybe, a few, a week, maybe, just kind of baby steps in a way. Yeah, because people just have a really hard time with making major changes, right? Especially when they're not feeling well. And so I just do little baby steps like that, of incorporating uh, organic, hopefully organic, but it's expensive. So just, whole fresh foods, instead of processed foods, that kind of thing. I've done that with my own kids. I've actually cooked for them for 16 years now. Yeah. So they haven't had any processed foods or fast food or sugar, that kind of thing. So yeah.
My son he's 8.5 and he's never had a Pop-Tart. He's never been through the drive-through. And one time
Wow.
he likes to play little like pranks and stuff. And he
Mhm.
told me, he was like, Daddy took me through the McDonald's drive-through. And I was like, no, he didn't. He wouldn't dare. But anyway, the food thing, it is a big deal, guys. And also
Mhm.
there are certain chemicals and ingredients in
Mhm.
processed food that
Mhm.
make us addicted to them. There is a
Yes.
reason why you can't just eat one Dorito, and
Right.
then also
Right.
I like that you mentioned baby steps because
Mhm.
one of the top reasons why, individuals have a hard time following through with like
Mhm.
a wellness plan is
Mhm.
sometimes the practitioner gives them way too much to do too fast and there's not enough
Yeah.
support and they're not ready for it. And
Mhm.
also seen a lot of fear mongering from
Mhm.
health and wellness professionals
Mhm.
all up on social media
Mhm.
telling people like, don't eat fruit. Fruit has sugar.
Yeah.
Don't
Yeah.
eat lectins. Don't eat oxalates. Like, what do you think
Yes.
about all of those things?
Oh my gosh, I know. I came across that the whole oxalates thing, and I thought, oh my gosh, and I was looking through, the list of foods I've been giving my kids, even though they're fresh and organic, and I'm like, oh, so do we have to eliminate this, and then I thought, no, this is just overdoing it. It's kind of I'm just not extreme. I don't like to be extreme about things, so I try to balance everything. You just have to. You can't eliminate everything, and then I don't know. It's just difficult because everybody has their own perspective, and I try to be respectful of that too.
Yeah, yeah. And one of the things I like to do for my clients is I like to get a list of what are your favorite foods, and then I will, send them recommendations of how they can recreate that in a healthier way. But I don't want anyone feeling like they just have to sit at home and eat kale. And then I also think
Yes.
damaging when we scare people to death.
Yeah.
And this is like what, because I am kind of that personality type that if I'm
Mhm.
going to do something, I'm going to like really, really probably overdo it. I'm not.
Okay.
And when I first started with functional medicine, they were like, they actually put me on the autoimmune protocol, which is crazy
Okay.
restrictive, something I don't
Mhm,
really
mhm.
recommend, and
Yeah.
all organic. And I went like 100% because I'm
Mhm,
crazy like that. And I thrive in social situations.
mhm,
And when I would get invited to dinner with friends, like I would
mhm.
not go because I was like, well, I can't have the food.
Right, right.
About like the social situations, when somebody's
Mhm,
trying to eat healthier, but then say they get
mhm,
invited to like a birthday party or they get invited
mhm,
to dinner with friends.
mhm. Oh, I'm
What do
sorry. I
Oh,
missed.
yeah, no, you're fine. But no, what do you think about that? Like as far as helping to provide them with balance, that way they don't feel
Mhm.
isolated.
Oh yeah. I mean, I will look at what they like to eat, right? And maybe find something that's equivalent, in some way that's more healthy, right? And help them along that way, and just to plan ahead, right, for these situations, and so that they don't feel like they can't participate. And yeah, because social activities are important, and relationships and connections. So yeah, the
Mhm.
whole. Mhm.
Yeah, yeah. And again, like I always another thing I tell people, I'm like, you can control what's in your house, okay? But again,
Mhm,
I
mhm,
think it's damaging when you're like, oh nope, I can't go to your birthday
mhm,
party, best friend. I'm gonna sit at
mhm.
home by myself and eat my organic dinner. Or you're going out places and you're sitting there at the table and you're just drinking some water while everyone else enjoys their
Right.
that sucks.
Mhm,
So I
mhm,
tell people, I'm like, like the goal is to get you to the point where you want to eat the good, healthy foods. But again, you can
uh-huh,
never live in a bubble, and it's not
right,
healthy for you to live in a bubble. So
right.
control what you can in your home. When you're out at a friend's house for dinner or a restaurant, just
Mhm,
do your best to make the
mhm,
healthy choices.
mhm.
I mean, I will stay gluten free if I go to a
Right.
restaurant, and I will
Mhm,
get something that resembles food. And another
mhm,
thing that I'll do is I'll pray before I eat. I mean,
mhm, mhm,
pray for God to bless that
mhm,
food because
mhm,
again, the stress of feeling like you're like highly restrictive, I mean,
mhm,
that's
mhm.
not good for you. We've
Right,
got
right.
to like, give people that ability to have flexibility and unwind.
Yes,
So, um,
right.
well, this was great. So, I also want to ask you. So, I'm going
Mhm.
to be posting your websites in
Oh,
the show notes. That way, if we have listeners that want to work with Bonnie, because it really is like, if you're struggling with your health, having a good
mhm.
practitioner like in your corner that gets it, it's huge. And are you on social media? Like, can people follow you there?
Oh yes, on Instagram and Facebook. I'm not very good with all that social media and tech, so yeah, I might be. I'm hoping to hire somebody, but in the meantime, I'm working on it. Yeah.
Oh, okay, great. Yeah, I hate it. Yeah, I hired somebody to like schedule out all of
Oh,
my
that's
things. I
good.
don't have the time for it.
Yeah.
Yeah, so if you're interested in working with Bonnie, be sure
Mhm.
to click on those links. And also, to our listeners, I want to thank everyone for tuning in. And again, here at Nurses Out Loud, make sure you tune in Monday through Friday, and we
Mhm.
are always happy to provide education and to advocate for you because, we are nurses and this is what we do best. And if you want to check out my training program, so if you're a nurse and you want to get functional training, you can find me at functionalnurseacademy.com. If you are any other healthcare profession or certified health and wellness coaches, then you can train with me at Christian Functional Medicine Academy, which is christianfma.com. And until next time, be safe, be well, and God bless.
This was brought to you by Functional Nurse Academy. For more information, be sure to go to functionalnurseacademy.com.